You're watching UNICEF Television. In the outskirts of Kenya's capital of Nairobi, at Makadara Health Center, the World Immunization Week has kicked off with a large gathering of parents who have brought their children for the free immunization clinic. This is the third time that Kenya marks this global initiative, with campaigns publicized in the media to emphasize the importance of immunization.
Immunization Week is meant to actually complement the routine vaccination that takes place throughout the year, where an intense activity during the week aims at reaching those children that have not been reached and increasing the coverage of immunization with all vaccination antigens, especially those children that are being left out. Here in Nairobi County, it is clear that progress has been made. There is a high coverage, but there is still a number of children that are being missed out.
Through plays and skits, parents and caregivers are persuaded to bring their children for vaccination and prevent potentially fatal childhood diseases. Immunization teams are expected to roll out the campaign nationwide during the week to ensure that children under 5 are immunized against measles, diphtheria, whooping cough and polio, as well as other critical health services.
It is a very important week for all the kids who are under 5, and we as the staffs who are serving them, we are very happy, and we are targeting by the end of the week we should have immunized around 300 kids. So the main theme of today's is to save life, to prevent the disabilities, and by that we do by giving them immunizations at various points. We also keep at monitoring at these children, their weight, their growth, and all the milestones that we require to know.
Jacinta Wamboi is one of the mothers who have come for the final round of vaccination for her 5-month-old son, Paul Mwendwa. She knows very well the importance of vaccination after she witnessed a neighbor's child become permanently disabled by polio a few years ago.
Mwanzo wangu wakati nilipata mtoto, niliambiwa ni lazima mtoto anapelekwa chanjo juu ya magonjwa yenye inapataga watoto wandogo na mwishowe wanaaga. Sasa mimi nikaanzia kliniki yangu kutoka akiwa na 6 weeks, na akapewa shindano ya kwanza na akapewa vitamini A. Tukakuja ya pili akapewa shindano ya chanjo ya pili, tukakuja ya tatu akapewa chanjo ya tatu. Sasa tuko ya 5.
During the week, health facilities also use the opportunity to provide antenatal and postnatal care to pregnant women and new mothers, and to talk about good hygiene and feeding practices.
We want to achieve the MDG number 4 and number 5, and it is important that we spare no efforts. We spare no efforts. All communities, all people of goodwill, our politicians must be brought on board, because we are not there yet. We still need to do more in terms of high impact interventions. We need to do more in terms of maternal survival in this country. So it is important that we bring partnerships. And I think one strength that we have in this country is that we have embraced partnerships for health, and more so in Nairobi.
Globally, immunization averts an estimated 2 to 3 million deaths every year. Last year alone, a total of 220,000 infants were not fully immunized in Kenya, exposing them to deadly and disabling diseases. UNICEF and its partners are stepping up efforts to ensure every child in Kenya is reached to save lives and prevent disabilities. This is Daisy Serem for UNICEF Television. For more information, go to www.unicef.org. Unite for children.